So before COVID, we already knew that families with lower incomes, families in need, were struggling with access to healthy foods. But COVID has really exacerbated those impacts. So we've seen with schools shutting down and restaurants shutting down and many families losing jobs, that more and more families and households are finding themselves in need of assistance. So we've seen food insecurity rates skyrocket, and more Americans are struggling to find access to healthy foods due to lost wages and lost income.
Early in the pandemic, we saw miles long lines of people waiting for food distributions at food banks. Since COVID, we have seen dramatic jumps. So now the data we have is showing that we've already jumped to about 26% of people across the US are living in food insecure. And what that means is they don't know where their next meal is coming from. COVID is creating conditions in society that also lead to higher incidences of obesity in the long run. So reduced access to healthy foods, limited opportunities for physical activity, loss of jobs, loss of income. These are all really important things to be considering, and we are seeing disproportionate impacts amongst people of color and amongst people with lower incomes. And these are populations that were already experiencing higher rates of obesity and higher incidences of chronic or diet-related chronic diseases pre-pandemic. So what's happened is now we've created conditions that make the healthy choices they were striving for even more difficult to achieve.